We are so honored and delighted to have the President and CEO of UNC Health Nash, Dr. Lee Isley, with us. And Dr. Isley, I want to say on a personal note, when I heard that out of 2,200 hospitals in the nation, that our hospital, our community hospital folks, were getting one of 32, only 32 awards for best hospitals out of 2,200. When you found out in November that this was going to happen, what was your reaction, and what did it say to you?
Sure. Well, I think it was a testament and a tangible recognition of the hard work that the board, the medical staff, and all the staff have been doing over the last 4 or 5 years, where we've really been focused on improving the quality and the consistency of care. As you know, Gene, one of the things I shared with the board was that, and I'm a little embarrassed to say this, that after 30 years in this industry, I wasn't familiar that Leapfrog, which is the private, not-for-profit group that reviews hospitals across the country, actually had these awards. And of course, there are 3 categories: rural, teaching, and general hospitals. And UNC Health Nash falls into the general category. And so I guess around November, Dr. Ann Schreiner, who is the chief medical officer, and I received notification from Leapfrog that UNC Health Nash had been selected. And so actually the first thing I did was get up from my desk and walk across the administrative area and ask Ann if she had gotten the email as well and if she knew anything about it. So it was a very pleasant surprise for us to learn that Leapfrog independently goes out and recognizes those 2,000 plus hospitals for looking and identifying only the top hospitals across the country. And again, what they're looking for is those hospitals that have significant improvements in reducing infection rates, increasing the outcome of surgery, and medication safety and education with their patients, and then a patient experience. And so you have to have those 4 categories. They are independently pulled from Leapfrog, and then they evaluate that, and they rank order us amongst those 2,000 hospitals. And we were one of the 32 that fell into the top of those improvements and categories.
I bet you couldn't wait to tell the staff.
When in November, as you may remember, when Ann and I knew, Leapfrog doesn't allow us to even tell the board for about 6 weeks. And then we were able to, in closed session, let the board know. But it was then about another 6 weeks before they allowed us to let the staff and the public know. And so it was a difficult 4 weeks or 12 weeks to keep all of that under wraps and not celebrate with the staff, because that's really the medical staff, and the staff have been doing the hard work around this improvement.
I see this, Dr. Isley, as a huge celebration for our community. I mean, the fact that we in our area have a hospital that is nationally ranked and recognized. The days of Nash General, we're going to talk about the new name and whatnot. I mean, this to me is a new day to say, because we're going to talk about how far we've come, but for all 4 of those standards to have to be at the top for us to be recognized. I mean, I think the community needs to join in the celebration of feeling really good when they have themselves or a loved one who needs to go to a hospital. How great that we can stay right here and know that we've got that caliber right here.
Well, I do think that that the public should recognize, and I hope that they'll acknowledge that, 4 or 5 years ago, as the board was bringing me into the community and asked us to focus on certain things. Those were certainly the 4 top things that the board asked me to focus on, financials being the 5th of those, and then for recruitment of physicians and the medical staff being the 6th. And so I really do think that this is, I hope, an acknowledgement that we heard the community when I went out and I spoke to the community and civic groups and churches and different organizations across the community. There was a consistent message that they wanted this hospital to be successful, but just as important, they wanted to make sure that they could trust the hospital to deliver good, consistent, quality care that we could measure. And I think I think this is an opportunity for us to celebrate that we listened. We've been working on this, and together as a staff and a medical staff, we have been singularly focused on making sure that we achieve these things for the community and our patients. And so certainly as we come in, there are always opportunities for us to work on, continue to improve upon, but I hope that the community will recognize this as, us listening and then going out and working on their feedback.
And I have to say, when you came, we were in the CD category for Leapfrog. The reports that would be given is, well, this is where we are, and we haven't been able to see significant improvement. Well, the board said to you, and you responded, and the staff responded, we don't want to hear this is where they are. We want to hear how are they getting better. And to think that we've reached this point is just great. But let's talk about strategic planning. I mean, we have there's been a lot of work given to planning, to looking at core values, to looking at our mission, to involving and really making a lot of changes. Talk about those, please.
Well, I think one of the areas that helped us be able to focus on those 4 areas and finance and recruiting was around the strategic plan. We needed an opportunity to dialogue with our community, hear what they wanted and needed us to achieve to be successful. We needed to speak with our medical staff and engage them, our board and our staff, in what were we all working towards and reach an agreement. That doesn't mean that we always came up with the same items or the same areas to work on, but we needed to come up with 4 or 5 areas of improvement that we could all agree to so that we could measure along the board, the organization, staff, medical staff, we could measure where our efforts and our energy were fitting into those priorities. And quite frankly, my group will tell you that if it didn't fit into those priorities, then it was not a priority, and we just could not put the energy towards it, especially early on, early on in the 5 years of my tenure here. If it didn't meet those criteria within the strategic plan and it wasn't going to forward us, then we really couldn't expend those resources. And so that's what I think we were laser focused on that. My team did an excellent job. The medical staff did an excellent job of buying in, even when they had questions about it. But we all bought into it and we worked towards those common goals.
And to think that through COVID, when there were already additional stressors and whatnot, to come out of that even is strong, being one of the 32 top out of 2,200 is just amazing. One of the methods used to help with the different departments were the creation of dyads. Tell us a little bit what a dyad is.
Well, a dyad is where we have an administrative director, most likely in a clinical area, so a nurse or a physical therapist or an x-ray tech that is working with a medical staff member, and they work together on their department goals and quality improvement areas that are forwarding and supporting the organizational goals. And they work together as a team, and that's what a dyad really means, is a team working together and communicating together with the staff and with other medical staff colleagues on what that department or area needs to accomplish. And again, we at the administrative level work with our department leaders and that physician to make sure that their goals for their department or area are rolling up to support the organizational goals.
Well, we are going to go right now to Bryant T. Aldridge Rehab Center, the example of the one they did, and we've got 2 staff members who are in leadership who are going to tell us how they applied that there. So let's take a look. We are really happy to be joined by Jeannie Lane, the director of Bryant T. Aldridge Rehab Center, and Dr. Patrick O'Brien, who is the medical director. And You all have been chosen to come and explain dyads and how they work, and it's been really successful for the hospital. But Dr. Bryan, how about explaining kind of what is a dyad and what's the purpose of it?
I see dyads as communication, where we as a physician group coordinate our activities through communicating on a daily basis with the nursing, therapy staff, and any associated staff within the rehab hospital. We are working hard in the rehab center to decrease untoward events, improve our efficiency, and to be kind to others. And we have been very successful using the dyad to help us with that. Wouldn't you think, Jeannie?
Absolutely.
Jeannie, I'd love an example. So it's you all are the dyad. There are two people kind of in the definition by definition, so the medical director and the director, but then you involve the staff and all of their input too. And I guess the patients too. I mean, you're seeking input from patients, so it's kind of a collaborative event.
I think that the patients definitely benefit from dyads because we're trying to improve the excellent care that we're giving them. We identify areas that we could improve in and work together as a team, and we engage the patients and families. An example would be falls. We really worked hard in the rehab center to make sure that we could decrease our falls by engaging the staff and the patients. When a patient's admitted, we right up front, assess whether they're going to be a fall risk and communicate with all the other team members, but we also include the patient and family as to why they have alarms and preventing falls.
And we'll do that with falls. We will do that with lines. Say the patient has a catheter. Say the patient has a line left over from the hospital. Jeannie and I and our PAs and nurses will all work together, communicate every day, see if these things that may contribute to falls or infection are necessary in the rehab center still. And we try to get rid of as much extraneous equipment as possible. And we've been successful with that, wouldn't you think, Jeannie?
Definitely. We have not had any catheter-associated infections or any bloodstream infections from a line. And that is something that the hospital actually, part of the dyad is we get with infection control every week and we talk about lines and Foleys and trying to get them out to prevent all infections.
And you share this with other, you go to medical executive committee and get collective wisdom from others too, right?
Yes, all our information is shared with the medical executive committee, and we'll trade ideas on how to decrease all of these things, whether it be infections, bladder infections associated with a urinary tract catheter, things such as that. Those are the two prime examples. The hospital's taken a lot of the input we've provided through therapy and nursing regarding falls. We'll use that as an example. And overall, I think patient falls within the healthcare system has dropped dramatically over the last 12 months.
Jeannie, I think I remember at one point you were kind of the lead of all UNC hospitals, and so you were training them and sharing ideas actually from our hospital with others in the UNC system, right?
So yeah, we still actually are meeting now with the system, and I represent our hospital for that and trying to look at any new ideas because it's always changing and we're always trying to find any ways to decrease any falls.
This sounds like it's a real win-win for our community, for our patients, that y'all are working so well together.
Yes, I would agree with that completely. In addition to that, we don't just stay with one set of numbers that we're trying to help improve for the hospital. This is a very dynamic process. We change every year what our goals are and what we're trying to do to help with the facility, so that one of the areas we want to make sure is that if you look at the patient's respect and ability to understand that the healthcare provider, whether it be a doctor, a nurse, or a therapy, is treating the patients with courtesy and respect. And we really want to improve those scores because we ask for them their feedback on all of that. And so this year, that's a main target for us. And we've had some very good success this year with that.
I have seen your scores. They are excellent. Absolutely. Well, thank you. We're going to get Dr. Isley to join us again, and he's going to talk about DIAD in the medical and the emergency department. Thank you.
Thank you.
Well, thank you very much.
Dr. Isley, the emergency department is also very engaged in a DIAD operation too, right?
They are, as all the departments are. And so Meredith Denton, who is our director of emergency department, working with Dr. Alex Warren as the DIAD for that section. And so they're working on a lot of innovative approaches that ultimately help the patient flow and move patients around. One of the things that they continue to work on is what we call a vertical model, where we're doing tests and moving patients around throughout the emergency department, and they may not be in a bed yet. And we're making sure that we're prioritizing the patients based off their condition and moving them through the emergency department.
And we have the highest number of people in our ED in all of the UNC system, about 60,000 a year. So that's hard to plan for, but they do a great job.
We are the busiest emergency department in the UNC health system. And so it's a very busy emergency department, and it is quite challenging.
So let's talk about our new name, our new logo.
Yes. So the Board of Commissioners worked with UNC Health in its strategic plan to evaluate how we as a system continue to roll out across the state. And our Board of Commissioners approved us changing our name to align with the UNC Health new logo and name change. And so as of January 9th, Nash UNC Healthcare has become UNC Health Nash. And that will really start with changing out some electronics and website type name changes. You'll see that across. We should start seeing that in the newspaper and other media print. The signs and other changes will take a little longer because of supply chain issues and some other issues as we work out throughout the state. The important part of this is that this is doing business as. So we really haven't changed our license name as a hospital, and we really haven't changed that since the doors opened in 1971. We have continued to work under the same assumed name that the state has licensed us. And so we still have our local Board of Commissioners, 14 men and women who work and live here, who ultimately have the last say and the fiduciary responsibility for this organization. And so we work in tandem with UNC to make sure that we are delivering high quality health care and coordinating that care across the state.
Which indeed you are. And thank you on behalf of the community. I just really have seen such progress, and I'm so grateful as a person who lives here for all that's been accomplished. So thank you.
Well, it has been a wonderful journey. I look forward to our continued future together here and working with our communities in Nash County and surrounding areas. And so thank you very much.
You're welcome. Thank you.